Cystic fibrosis is a genetic disease that affects the respiratory system, like the lungs and heart. It is a single-celled disease commonly seen in children. Ways of diagnostics include the sweat test and the newborn screening tests, among others. Terms you should know include CFTR, cystic fibrosis conductans regulator, infertile, unable to conceive offspring, airway, the path air follows to get in and out of lungs. The mouth and the nose are the most common entry and exit points. Enzymes, proteins that act like catalysts in mediating and speeding a chemical reaction. In 1989, researchers found the defective gene that causes CF. The disease could be worsened by factors like pollution in an area or nuclear waste. Clinical symptoms include sinus problems, nose growths, salty sweat, trouble breathing, abnormal pancreas function, trouble digesting food, gallstones, enlarged heart, frequent lung infections, excess mucus, excess sweating, frequent digestive upsets, and underweight. Before and during cystic fibrosis, individuals have been prone to be in an irritable state and depression due to isolation from others.
Like, you feel normal, then there's some days where you just don't, and those are kind of tough days. Where it kind of hits you like, you know, will I ever have kids? Will I ever be married? Can I ever, like, really be, like, normal, you know?
CFTR genes are inherited from each parent. If a parent has a normal CFTR gene and a faulty CFTR gene, a child has a 25% chance of inheriting 2 normal genes and a 15% chance of inheriting 1 normal gene, 1 faulty gene, and a 25% chance of inheriting 2 faulty genes. Tay-Sachs and cystic fibrosis are similar yet different. Tay-Sachs is a neurological disorder prominent in the Jewish community and creates motor skills difficulties, weaknesses in developing children. Yet cystic fibrosis occurs in the respiratory system, affecting the lungs, heart, etc. It affects the high levels in sodium in your sweat and causes nutritional problems. They both have visible symptoms. Both are recessive, so both parents must be carriers, fatal, both common in children, and are both multifactorial. This disease is polygenic. A polygenic trait is controlled by a group of non-trait-like genes.
Today is my 21st birthday. The doctors told my parents that it was really unlikely that I would live to be an adult. Today is a really big deal because I'm beating the odds and proving.
I think the one thing that I've always described cystic fibrosis is a curse of a blessing. It's a curse for the obvious, for the sickness and the hospitalizations and not feeling well and not having a lot of energy. But in a sense, it's somewhat of a blessing because when you have something like this, you embrace life so much more.
One of the things I learned from Larry is life is too short to worry about little things.
What I fight for is just one more day.
Yeah, I think I appreciate life a bit more, especially more than people my age, like people in their 20s.
Treatment for cystic fibrosis includes physiotherapy. There are vests that inflate and vibrate in order to bring up mucus out of the lungs. Another method would be in a nebulizer. And a nebulizer is a machine that patients use and inhale DNA or vaporized liquid that fights off mucus in the body. There are also inhalers, as used for asthma. It stops inflammation and mucus in the lungs. The last and most common way of treatment would be pills. A patient would consume anywhere from 2 to 40 pills a day. Around 2,500 babies are born with cystic fibrosis every year. About 30,000 people in the United States have cystic fibrosis. Cystic fibrosis is one of the most common inherited diseases in Caucasians. About 1,000 new cases of cystic fibrosis are diagnosed each year.